Hi everyone, welcome back to my YouTube channel. Today we are going to talk about neoplasia. So let's start our topic with introduction. Neoplasia is a fundamental concept in pathology referring to abnormal and uncontrolled cell growth. It results in formation of neoplasm which may be benign or malignant. Malignant neoplasm are commonly known as cancers and represent a major global health burden. Definition of neoplasia. Neoplasia is defined as new growth of tissue due to abnormal proliferation of cells that persist even after the removal of initiating stimulus. The resulting mass of tissue is called as neoplasm. Characteristics of neoplasia. There is uncontrolled cell division. Second is there is loss of normal regulatory mechanism. Third, there is persistence independent of the external stimuli. Fourth, is potential for invasion and metastasis, that is in case of malignant form. Classification of neoplasm. First is benign neoplasm and second is malignant neoplasm. Benign neoplasm is localized, slow growing, non-invasive and generally not life-threatening. And malignant neoplasm, that is also called as cancer, it is rapidly growing, invasive and capable of metastasis. Nomenclature of neoplasia. First, there is benign tumor that are named by adding the suffix "oma", for example, adenoma and fibroma. Second, there are malignant tumor of epithelial origins, for example, carcinomas that include, for example, squamous cell carcinoma. Then there are malignant tumor of mesenchymal origin that are called sarcomas, for example, osteosarcomas. Etiology of neoplasia. Neoplasia arises due to multiple factors. There may be genetic mutation in proto-oncogenes and tumor suppressor gene that cause neoplasia. There may be environmental factors like radiation and chemical that may contribute to neoplasia. There may be viral infections like human papillomavirus, Epstein-Barr virus, and hepatitis B virus that may contribute to neoplasia. There may be chronic inflammation that may be causing the neoplasia and lifestyle factors like smoking, diet, and alcohol. Pathogenesis of neoplasia. Neoplasia develops through a multi-step process. First, there is initiation, during which genetic mutation occurs, and second, there is promotion, in which mutated cells proliferate abnormally, and third is progression, that is further mutation that leads to invasive and metastatic potential. Morphological features of neoplasia. First is benign tumor, that is well differentiated, encapsulated and non-invasive tumor. Second is malignant tumor, that is poorly differentiated, irregular borders and invasive. There is necrosis and atypical mitotic figure in this case. Clinical manifestation of neoplasia. There are local effects, there is mass effect, obstruction and ulceration. There may be systemic effects like weight loss, anemia, and cachexia. There are paraneoplastic syndrome that may cause hormone secretion and metabolic disturbances. Diagnosis of neoplasia. First we do is clinical examination. Second we can do imaging that may include X-ray, CT, or MRI. And third we can do biopsy and histopathology. And we can also do molecular and genetic testing for neoplasia. Treatment of neoplasia. We can do surgery for localized tumors. We can do radiotherapy, chemotherapy, and targeted therapy and immunotherapy for neoplasia. And also there is palliative care required for advanced cases. Conclusion of this lecture video. Neoplasia represent abnormal cell growth that can be benign or malignant. Malignant neoplasm are a major health challenge worldwide. Understanding their causes, mechanism, and clinical feature is essential for early detection, effective treatment, and improved patient outcomes. And this is all about neoplasia. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.